Sitting across me is my next guest. She goes by the name of Loli Gqiba. Welcome to the podcast.
Thank you, Musa.
The last time people saw you was on the documentary, which is available on this YouTube channel, if you are watching this on YouTube. Since then, what has Loli been up to?
Nothing much except trying to find a balance in my life. As you know, I'm a wife,
Yes,
I'm a mother,
yes,
and I'm also an anaesthetist by profession.
yes.
I also have a passion for fitness. So trying to balance it all is almost impossible, but I've been there trying to find my feet and trying to find my way around my life.
I feel like some of the guests, well, when I thought about this podcast, I thought about sharing information, which is obviously one of the reasons that you're here. You mentioned that you're an anaesthetist. So for people that don't know, can you explain what your line of work entails and how did you get into it?
With pleasure. What I do basically is when you're going for an operation, I'm the one who keeps you alive. I put you off to sleep, and I also make sure that you wake up. I also take care of critical care patients or patients in the trauma setting. Yeah, basically we are in that saving lives.
Okay. I think what you forgot there is to mention that you did medicine.
Oh, yes. So I first did medicine. Then after medicine, I specialized and focused on anesthesia.
Okay. How long does it take to do all that now? How much time does one have to invest?
It takes about 14, 15 years of your life.
Wow.
Yeah.
Wow. That's
It's a lot of time.
It's a lot of time.
Yeah.
And how did you find that? In terms of challenges and obviously lessons learned besides the theory that you're there for and the practicals, obviously.
It's a long road. It's tiring, and it's also very challenging and demanding, especially working with people. But also you are studying and working at some stage in your life, which is very difficult to balance. And also anesthesia, when we were doing it, there were very few black people in it, to be honest. It was, I think, here in KwaZulu-Natal, I was the second or the third black female to qualify as an anaesthetist. The year that I qualified in 2016.
Wow. And when you guys are starting out the course, like how many were there in your class?
The females, there were so few. I think I can only count 3 by the time I qualified. There's Dr. Kumalo, Zanele Chata, and me. Yeah.
Wow, man. Would you say, is there a reason behind a lack of black females within the world of anesthesia, especially in this side of the world?
I think over time, more people have gone into the department now. But I think before, it was more of a white-dominated specialty. Yeah.
So right now, is there like a rise in numbers of people that want to specialize in anesthesia? More so from the black community?
I've seen a lot more people, yes, after we qualified.
Okay.
I've seen lots more, yes.
So for maybe, let's say there's an 18-year-old out there who could be interested in medicine, but they're not sure about how far they want to go. Even going as far as you've gone, because you obviously went an extra mile. What could you tell them that what to expect or how to approach getting into medicine, other than just the fascination of being a doctor?
I think what's important at that stage when you're 18 is firstly maybe go for they used to take us, I think it's called like career guidance, and sometimes they take you to if you're interested in a surgery, you go actually to a surgeon and see what doctors do on a daily basis. And then when you can see what the job entails or get an idea maybe for a month or so, and then you embark on the career. Because I find a lot of us get into careers without information, and you get into the wrong career, or you find that you are in it but you made a mistake. So I think going to get a work experience first, and then once you see, because it's not all glamorous in medicine.
Yeah.
There's a lot.
By the way, sorry to cut you. Just so that you don't keep looking around when. By the way, people, Loli, we are here with her. As she mentioned, she's a mother. She's a full-time mother. So obviously, to prove that, we are also here with her lovely daughter, and she will call her out every now and again. So just please bear with us. Don't judge. Just enjoy the conversation.
Yeah.
This podcast is so good that we got toddlers watching us.
Yeah.
Back to anesthesia.
Yes.
What would you say was your inspiration to take up anesthesia?
So I was still telling that young 18-year-old that, one degree, whether it's medicine, whether it's accounting or law, whatever you're studying is not enough these days. So you need to do your honors, masters, and so as with medicine, you need to specialize. Because now there are lots more GPs, so people are going into specialization and super specialization. So once you are a doctor, then the next step is to advance your career. And there are lots of different careers. It depends on what you speak to. But I think medicine is broadly surgical and medical. So then the surgical specialties, you can choose from there: plastic surgeon, orthopedics, obstetrics. And then the medical ones, you can be a physician, nephrologist, and so forth. So what I liked about anesthesia is that it balances both surgeon and medical. You get aspects of both fields. For example, if someone is a pediatrician, they only see babies. If someone is an obstetric and gynae, they only see pregnant women. Yes, but
it's only Euro related.
Yes, so when you're doing anesthesia, you see all aspects of patients. You see babies, you see pregnant women, you see orthopedic patients, you see surgical patients, you see trauma. So I feel like it keeps you as a general doctor. You sort of know exactly what to do with all aspects of patients, and that's why I chose it. And at the same time, you also become the person that everyone goes to. You can't sorry. This week at work, we had a difficult intubation in the pediatric ward. Yes.
And none of the pediatricians could get the tube down, or anyone for that matter, in that ward. So we had to call out an anaesthetist from theater.
Yeah.
I mean, so I guess that goes to show that you guys, you play a very vital role at a very crucial time.
Yes.
Wow. And then in terms of workload, what can one expect if you get into the field of anesthesia?
It's a lot of workload because, as I said, you cover all aspects of medicine and surgery. You cover ICU. So it takes a lot of determination and hard work. But once you specialize, you can then get to choose. Other people super specialize and go into critical care, and they only deal with critical care patients. Others go into pediatric anesthesia. Others do obstetric anesthesia. Others just follow the route of pain. So I think after you specialize, then you can get to decide what you want to focus on.
And the studying, how much?
Studying.
Before you answer, I heard somebody say you need ABCs in order to pass in medicine, and that basically just apply bad to che.
Yeah, a lot of studying. A lot of studying, a lot of time. It takes a lot out of you.
And I know. Okay, you waited until you were done. Then you and your husband decided to start a family. Was it planned or for you guys, or maybe it was just God's grace that you guys were blessed enough that you never had, you didn't have a child while you were studying, so you obviously had more time.
You know, the truth is, Musa, is that with medicine being such a long career path and waiting, you get older, you know, and parts of us, I remember when we qualified, we sort of regretted waiting that long because we suffered lots of miscarriages. So I don't know whether it's a double-edged sword or what can I say. Basically, when you focus on the career, then there's a time where you want to have family, and that time, unfortunately, may be too late. I don't know if it was a good decision or a bad decision, but we're blessed to have a child now. Yeah.
Wow. And how's that, being a mother?
Oh, I think that's harder than anesthesia.
Is it?
It's harder. That role has taken me much. It's much harder than the 14 years in medicine and anesthesia.
Yeah, and you only 2 years in.
Oish, and I still want another one.
Yeah, you did tell me that.
Yeah.
And so is it only going to be 2 or is there more?
For now we said 2.
Okay.
We said 2. Yeah.
Wow.
For now.
And so I guess you're happy with Imi.
Yeah, we're glad to have her. Yeah.
She's a great addition to the family.
Yeah.
You guys recently went on holiday. How's that traveling with the toddler?
We've been traveling with her since she was 4 months. So I guess you can say, older parents with the child for the first time, they don't want to leave the child. So since she was 4 months, she's been traveling, and she's very good with traveling. She's good with flying, and she really doesn't give much problems. So she's very easy to travel with. But she's in the terrible twos now, so she's very busy. Ooh.
Yeah. Yes, she is right now. Good thing though.
I think she'll run around here in the next few seconds.
Well, we don't mind. It's fine. People will have to understand.
Yeah.
Well, besides, everyone else might think that, okay, they brought this doctor here to sit and talk about this glamorous life that she's living. For people that don't know, you just a rural kid that grew up in the Bundus, typical black SA background.
Yeah.
How was that growing up?
Growing up, my mother had me when she was very young. She went to study at Wits, and 10 days when I was 10 days old, she left me with my grandparents, like all of us.
Yeah.
So our grandparents raised us with my cousins. And, you go to the typical rural primary school, and then you go to the township, township primary school and high school. And so, yeah, I think it sums up most of our lives.
Yeah. You grew up in?
I grew up in Mthatha.
Okay.
Yes.
So you were in Mthatha.
Yes.
All the way from Mthatha. So shout out to Mthatha. you an inspiration. No, seriously. Like you an inspiration. All the hard work that you've put into your life.
True.
And to get to the point where you are right now. I feel like it's high time we get more females such as yourself, who will show the youth the way to go about it. Because I mean, if you are female, you're a woman in this country, and you have a successful career, you are independent. Even though your husband is also an anaesthetist, you don't rely on him. So you guys are a team.
Yeah.
And I feel like that gives power to more women to say, hey, I don't have to aspire to just have a rich or wealthy husband. I can also be wealthy and meet a wealthy husband, obviously. If they are. No, I'm not saying that you guys are wealthy before I get you guys into trouble. Yeah.
But we both come from humble beginnings, and we met at varsity, so we were quite poor when we met. So we've really been like supporting each other and building each other. It's been a teamwork. It's not really the wealth. I don't think is that important, But I think, we were raised that education is what's going to get us out of the township. Education is what's going to make us better. Our key was education. Other parents leave their kids with maybe with money or with properties. So all our parents could give us was education. So we left with education. We've been building on our careers and focusing on education, and growing with education.
And how has life changed? I mean, you guys growing up when you were still studying, to the point that you are now, you are.
It's such a big difference. I mean, we used to laugh at how. We were fortunate to get bursaries in varsity, and we remember this one story about how before we got the bursary, so the bursary only kicks in around September.
So throughout the whole year, you just
so
hanging.
we were hanging, with like 50 rand pocket money, and how we used to eat, soup and bread. And then there's this funny story where now when the bursary came in, I remember my husband went into the kitchen or the dining room, and he's like, today, so the aunties would not even look at the slip and just give you soup and bread, And he's like, no. Today I ordered, meat and there is biscuits and so it's it's been a journey. It's been a journey. So and small things, but that have now, made us better, because we also have to take care of our siblings as well. We have to take care of our parents. So through growth, we've not only grown within ourselves, but we've also helped our families grow as well.
Is your grandmother still alive?
Yeah, she's still alive.
And how was she when you finally qualified?
Oh, she was so over the moon. I can't even tell you. And I mean, she's such a powerful woman. She really is like a queen. And she's been supportive. I mean, even when we had a baby, she came and stayed with us for like 6 weeks to help us take care of Imi. So she's really been like a pillar of strength. Even now, I mean, that Imi is a great grandchild, and she's still taking care of us.
She's a strong woman. Eh? It goes to show women are stronger than us. And your mom?
My mom is still alive as well. She was studying for most of my life. So she's a speech and audio therapist now.
Okay.
And she's focused in her career as well, trying to go into lecturing and
Wow, that's fantastic.
Yeah.
Now let's get into the other side of your life, which is fitness and wellness, obviously. Let's start here. What inspired that?
For me, firstly, it was not just fitness, but it was more health. Health being broadly, not only physical, but mental, psychological, spiritual, just the whole encompassing process whereby, I needed to be healthy for myself. And it happened after I'd given birth to Imi. She was 2 weeks old. And after pregnancy, I think most women would feel the same way. You sort of lose yourself. I remember there was a point where I couldn't recognize myself in the mirror. And I felt like the person I could see in the mirror was not the person inside. And I took my baby out for a walk. And as we were walking, I started thinking to myself, what kind of a mother would I be? Just asking myself like silly questions. Would I be a good mother? How do I see myself as a mother? How do I see myself now? Because I couldn't recognize myself. Who am I? What do I like? What do I like to do? And on that day, I realized that I needed to get to know myself. I needed to take care of myself first so that I could be able to take care of another human being. And that's what got me started into health and fitness. I needed to ask myself some few basic questions about my health. Am I prioritizing myself? Am I sleeping right? Am I eating right? Am I walking? you know.
Would you say your professional background sort of had a huge role to play in that moment?
And unfortunately, I wouldn't say that, because you'd assume that as a doctor, I was supposed to be healthy for the rest of my life,
Yeah.
especially teaching people day in and day out that they should be healthy. But, you know, I think as human beings, sometimes you separate your life. Career becomes separate from family, becomes separate from self. A lot of doctors are unhealthy. Lots of doctors are diabetic. Lots of doctors are not leading a healthy lifestyle. They're obese, you know, they don't do the basic things. And I guess it's just that we separate our lives, and we don't, you know, you understand the concepts, but you don't put it into practice in your life. So I think it was, I'd take it as a moment of just being a woman and a mother. That moment was just about that.
Yeah. How do you think are doctors healthy according to you?
No. Doctors are not healthy.
Why is that the people with the most information as far as health is concerned, but they one of the least healthy people in the community?
I'd say, honestly, I think it's just we don't use the information that we have. Instead, you know, you give the information out to other people. We're good at advising other people. And also, doctors get so busy taking care of everyone else, they forget to take care of themselves. The focus is always on other people, because even our working hours don't allow us to have a healthy. They're ridiculous, you know. So from a steady stage, as soon as you qualify, you understand that I have to work 24 hours taking care of other people. Then after that 24 hours, you're driving home. Still, that's self-neglect, because, you know, driving after 24 hours of working straight, you're almost like a drunk driver.
Yeah.
That's also self-neglect. So you are taught the self-neglect in order to give yourself to take care of other people's lives. And, you know, in the middle of the night, I don't know if other careers do this, but you could be woken up at 2 a.m. and have to come in and save someone else's life and still continue to work the day. You know, so I think it gets like into our minds that our role is to take care of other people.
So right now, you know, obviously personal health is of utmost importance, seems like it to everyone, because you see there's a high influx of people going to the gym, you know, joining gyms, making sure that they do get their daily workout. They're trying to change diets. There's also some negativity around that. People will opt for quick fix solutions. What's your take on people using prescription medication to maybe lose weight, so to say?
I think what's happened is that the pharmaceutical industry or other industries have seen the weakness, and they've seen that people are desperate. And so they are really milking into their desperation. And unfortunately, even some GPs or doctors get you know, reimbursed to sell these products to patients, which is sad, you know. So, for example, they sell them eating suppressants like Durban. And when they give them these supplements, they don't tell them that, you know, Durban can cause strokes, it can cause seizures, it can cause you to have a heart attack, you know, which could leave you permanently disabled. You're trying to lose weight and you end up with a stroke.
Wow. That's
or you could die, you know, and some of them cause renal failure. And all these side effects, you know, no one informs you of it. And people are desperate, you know, people who do lots of things. I remember I was listening to this lady at the salon and she was telling me that she's going to see a doctor who gives her something to inject herself weekly.
Self-injection?
Self-injection.
Oh, okay. Isn't that against the law?
I have no idea. I was like, Oh my God. And she injects herself weekly. And then she doesn't have to eat or so it's quick solutions, and then she loses weight.
Wait, so is it like intravenous injection?
I
Or is
think
it
it's
just
intramuscular or subcutaneous. I don't know. But I was so shocked. And it's expensive injections, like 6,000 or like that.
Oh my God. Just to keep the weight off and look good. Oh
And I'm
my.
asking her, what is it that you're injecting yourself with? And she doesn't know. And it's sad, you know?
All she knows is going to do what she wants it to do.
Yes, but we're not even asking questions. We're not even, now this is like the modern era, and you before you even go to the doctor, you can go into Google and search your symptoms. There's so much available for us than for us to be so ignorant and just, especially something going into your body. Like, I think an injection should be painful, I would think an injection needs more thought than a pill.
Even when you're in a hospital, like the last thing that you want is them injecting you.
Yeah. But,
and then I also see, okay, I don't know anything, so I'm just gonna ask you. If you don't know, you don't know. I normally see people taking these IV trips, these rejuvenation trips. Would you say that, I know it's being administered by medical professionals, but like I don't understand it. I don't understand the whole concept. Like, what is it for?
I want to know, for me, the main thing is, what are the ingredients
Of that IV solution?
because they won't give you, because it's sort of they'll lose business if they give you the ingredients, okay? But and then there's a solution we used to give in trauma when someone would come in drunk, and we'd give them thiamine. It's a vitamin, vitamin B1, and that would help them to have energy and wake up. And I don't know whether it's that thiamine drip now
that they're
using for healthy people.
Because my guess is that in order for us to work in a hospital setup to put up an IV line on you, it's because we want to get whatever it is that we're giving you as quick as possible, because obviously you need it urgently. But now when you are healthy, you're just hungover and you're just tired or you're just anxious. Does that now qualify me for an IV?
I guess it's the pressure of our society right now, and the pressure to, for example, if you're tired, you're not supposed to sleep. If you're sleeping, everyone's looking at you like, what's wrong with you, And it's a funny thing, because you have to keep up. You have to work 2 jobs, hustle and do this and do that. And the pressure gets to everyone. So I would think that these GPs are administering IVI vitamins, because vitamins are what we get from just eating a normal healthy diet. You're supposed to get your vitamins. But let's just say you are someone who's not sleeping. You're working till 2 a.m. You're running 2 businesses. You've got a family.
Or you're an artist. You're performing everywhere.
Yeah. So we basically don't even eat right. Maybe you are drinking. And so they're just giving you the vitamins. And maybe the vitamins are actually you're like your only chance of getting vitamins into your system. Yeah.
Okay. No, I get you. So, I mean, you mentioned that you work in a theater setup,
yes,
which is obviously administering anesthesia to patients before major operations. So, what's the cost of anesthesia nowadays?
Ooh. The thing is, what people don't realize is that anesthesia is actually more expensive than the actual surgery.
Yeah.
Because our job is to keep you alive during the whole surgery. So it really is more expensive than the surgery. It's about the price of the surgery and a little bit more.
So it's whatever the surgery is going to cost you and just a little bit extra.
Yeah.
And I remember speaking to you last time. you mentioned that if a patient is not on a good health status, it sort of like shoots up the price for anesthesia as well.
Yes. So if your risk factors are high, the higher the risk for the anesthetist. And so the more you have to pay in the private sector. So if you are obese, they calculate your BMI. If your BMI is more than 35, then it will be an extra price added to the normal standard anesthetic price for that procedure. If you have added risk factors and complications, that will also add more risk. If you are hypertensive and diabetic and have suffered a stroke, you are more risk. If you end up in ICU, even people who sometimes when you get obese, you get complications like obstructive sleep apnea, where it puts you at risk when they're about to be put to sleep. There's a risk that you may not wake up. Things like that can make you end up in ICU, and that also increases the anesthetic price.
I see a lot of people like lately on heavy medication. Like everyone is just taking some form of medication lately, and obviously, I don't know, for some reason, but like I feel like a lot of people are on medication just for unnecessary reasons, purely because they get to medical practitioners and they just prescribe because they just want to cash in. Any advice that people can use to judge a good medical practitioner from a bad medical practitioner?
That is a hard question.
I mean, you on the inside. So
yeah.
I know you. Well, I know you personally because I've worked with you.
Yeah.
You know your work. And obviously you wouldn't gone through that 14 years if you didn't know a thing. So I'm sure you can point out like ill medical practices that people, practice or use in medicine. Obviously, because here we want to help people out there. You don't want to go to an unreliable practitioner and put your life in their hands only for things to go south.
I think the main thing I'd advise to people out there and patients in general is that the more you self-inform yourself, the more you get to know about what's going on with you and your body, and you read up about it, the more you question, when a doctor gives you a medication and say, take this, you can even ask the doctor, what am I taking this for? What are the side effects? Is there another option? Or you could even, it's so open now, you have an autonomy to even go seek another medical practitioner. I just feel like we shouldn't be ignorant at this stage, Lots of patients come in informed, And I find this especially more in the upper class of patients, that they come in informed, they know their condition, they know their medication, they know the complications. And then you find that in the middle to lower class, they're just coming in oblivious to the whole situation. I'm hypertensive for 10 years, but I don't know what medication I'm taking.
Wow. But you've been taking medication. Oh. So would you say, is that a lack of information coming from the doctor's side, or is it a lack of just will to understand what's going on with you from the patient side, or is it both?
I think it could be both, but I think the person to blame is the patient, because you're administering this to your own body.
And you pay.
And you are paying, So I think the questions should come from you as to, what am I taking?
Yeah.
Do I need this? What could it cause me? What are the long-term complications? Is there anything else I could take? What's there in the market? We should, especially our generation, I'm not talking about our parents or grandparents' generation, but our generation should be more inquisitive,
So you would highly recommend that people start looking into health matters and understanding more how their body functions
Yes.
in general. So let's go back to your fitness journey. How's that been in terms of training? How long have you been at it?
It's been 2.5 years now.
Yeah.
I won't lie. It's a roller coaster. I'm a human being. You know, sometimes my life completely takes over. Like all moms and wives, you know, sometimes, you know, Imi needs me more. She gets sick, and then I obviously have to sacrifice some things about gym. But at the end, I think in the whole process, I always try to fit it in. It's a struggle for me. It's a struggle, but I fit it into my life. Yeah.
How often do you train a week?
I train 5 days a week.
Wow.
Yeah.
5 days a week.
5 days a week.
Where do you get the time?
I think
Not that I'm saying that's a bad thing, but I mean, like, you're a very
honestly,
busy person.
yes. You have to make it happen. That's the truth, you know. At every stage of our lives, you know, and even now, if I have a second child, I still have to make it happen. You know, the main thing about is to prioritize your time. It's a part of self-care. It's actually, it takes a lot of sacrifice, you know. So you have to plan. You know, for me, I wake up at 3:30 in the morning.
Wow.
Every single morning.
You're a superwoman.
I wake up 3:30, latest 4.
Yeah.
I get stuff ready for my husband and Amy, and then I'm at the gym by 5 a.m. Then I have to get to work by 8. And then, you know, I have to come out of work and it's prepare supper for everyone in the house. So it's basically, for me, I function better in the mornings. So I capitalize my time in the morning. I give myself time in the morning. Some people function better in the afternoon. So maybe they would try to squeeze in a lot of things in the afternoon. You know, so I think you have to manage your time and figure out what are your strengths, around which time are you more energetic. Yeah.
I know there's a project that you, let me say you're running. If I'm putting pressure, I'm sorry. Where you try to inspire mothers to come together for one and basically build one another and share information. How's that going?
It's going slow. I don't want to lie. But I think even if in life, you know, I end up maybe inspiring 10 mothers, you know, I would have done a good job, you know, because basically I feel like I'm living to inspire before I expire.
Wow.
You know.
Yes.
So I am trying, you know, and even if it becomes like talking over coffee, or I meet even the nurses at work, you know, it doesn't have to be formal, you know, but every day I try to talk to women and try to talk about myself, and hopefully someone will find something in my life to inspire them, because I am really a normal woman. Just now I have my 2-year-old here. I didn't plan to have her here. So, yeah, you know, my life gets upside down like every other woman. Yeah.
You know, you are absolute proof that women can do it all. Because like you're saying, I mean, you got your daughter here, but you're still doing this podcast with us. You could have just said, hey, I've got my daughter to look after, so I can't do this.
Yeah.
So I guess you're doing a great job as far as using your life as an example for other people that, you know, you can be so much more in life. You can be a mother and be so many things within the community. Any other plans that you have lined up and stored, or you don't want to blow the lead?
Let's not blow the lead. And plus, I don't want to put too much pressure on myself. Yes, but you know, for now we're trying to have a second baby. I don't want them to be too far apart. And so, you know, this is a lifetime journey for me. So I'm not rushing anything. And I'm trying to be true to myself. you know. And to grow, it doesn't have to be a rapid growth. It can be a slow growth, but over time we will grow. Yeah.
So right now, if you were, I mean, you're out there, you slowly becoming a public figure. That means there's a possibility that your responsibilities could grow, because maybe other people could come at you with offers. I mean, even after seeing this episode, seeing the kind of person that you are, we do need a lot of female heroes within our community, and I think you are one of those.
Thank you.
So would you consider anything else other than what you're doing now?
Yeah, I'm open. I'm open. Yeah, I'm open. If I can try and squeeze it in, maybe wake up at 2 a.m. But you know, I'm open. I'm open to lots of things. I think the good part is that I'm still young. You know, that's the great part about everything, is that I'm still young, and when you're young, you can handle a lot more things. Yeah.
You know what? Since you mentioned this, that you're young, I'm going to put you on the spot purely for one reason.
Yeah.
Just to show people that this is real. Hey, Imi!
I told you should be here.
Just to just to show people that, oh my God, I lost my point. Imi! You see, you're distracting me.
She'll come and join us.
Hey.
High five.
High five. Oh, shit.
Sorry. Late.
One cup. Come on, you know you want to.
Yay. Say sharp. Sharp.
That's Amy, guys, Loli's daughter.
Yeah.
She's adorable.
Thank you.
Well, I guess that means she said, this is enough. Somebody.
Want some water?
Okay, no, it's fine. I think we've covered pretty much most of what we needed to cover. We can call it a day. Thanks for sacrificing. I mean, you put your whole entire life on hold for us.
Yeah.
We highly appreciate that. And obviously, this is not the last time that you come on to this podcast. So you're definitely coming back. And for people that don't, or I know you guys don't know, I'm going to try and twist their arm into doing a podcast somehow. I guess that's when you start waking up at 2 a.m.
Yeah. I guess so.
So that's from now on, from here on, this is when that's what could happen.
Onwards and upwards, eh?
Yeah. Thanks for joining us, Loli.
My pleasure.
In closing, any advice that you'd like to give young women, young mothers? Okay.
Yeah.
I remembered. You said you're young.
Yes.
And the reason I would like you to tell our audience your age is so that, I mean, young people can see that it's possible to accomplish what you accomplished.
Yeah.
Just as long as you have the right mindset. And I know, and well, pretty much the rest of the world knows that you don't get to be a specialist doctor without a lot of sacrifice and a lot of studying.
Yeah.
So just to highlight, how old are you?
Okay, so I'm 31.
Yes.
I was fortunate to finish high school at 16. Yeah. So I started school at 3 years of age.
Damn.
And I think it's just because my parents could not keep me in the house. They needed to go to school, so everyone needed to go to school, and there were no creches, so they said grade 1.
I think it would have been the same case for Imi if she was born in your time.
Yeah. So, yeah, school at 3, and then my life just continued. So I was fortunate to finish early, and so, yeah.
Wow, that shows how intelligent you are.
Thank you.
I mean, you are ahead of your time.
Yeah.
Wow. Thanks, Loli. Thanks for coming onto the podcast. You were an awesome great guest. You were a very informative person. We'd love to have you. I have so many questions that I would have loved to ask you, but obviously because of time.
And Imi's already tired.
Yeah, Imi needs your attention more now. Before she comes back and take over the set. Thanks for joining us. Well, it's been real. Loli, oh shit, I almost stole your moment. Please give people your social media handles. Where can
Oh,
they find you?
yes,
Because I
yes.
mean, maybe people would like to follow you, get some inspiration when you. Because I do know you post your workout sessions.
Yes, yes.
Yeah.
At Fitmom_Struggles on Instagram. Only on Instagram for now.
Yes.
But I plan to
expand
to YouTube, and I'm still growing,
and please start that
slowly.
YouTube channel quickly.
Yes, yes. And the other thing is, I'd just like to say to women,
Yes.
especially young women, is that take care of yourself. Make yourself a priority, especially your health. From an early age. Take care of yourself, love yourself, and prioritize yourself. Yeah.
Wow. Thank you. It's been real. There's another episode from the GNPS crew. Shout out to Tiny and Q behind the camera. You can find us on Instagram at general_Genie. On Twitter, it's at general_Genie. The handle for the podcast, it's at GNPS_podcast. Otherwise, please subscribe on the YouTube channel and on Apple Podcast. We are available on Spreaker, Spotify, Google Podcast. It's been real. Shout out and peace.